Hey, welcome back to the Bullpen Sessions podcast. My name is Andy NEARY, and this is episode 303. I am excited today to have Niko Caparisos join me. Niko is the founder of Prosperity Benefits in Savannah, Georgia. Today, we're talking about a very unique program he has built and is having a ton of success with community-owned health plans, how you can build health insurance plans that bring collaborative ideas to your local communities and promote a lot of the local healthcare providers in your town. So a lot of good information there, but I also wanted to have Niko on because he is, one, a good human, but two, very driven advisors. So not only do we talk about the COHP model, but we also talk about what makes Niko tick, why he built Prosperity Benefits, how he has built it around his lifestyle, and his thoughts and beliefs about things like stoicism and taking care of yourself mentally, physically, and nutritionally. So I think you're going to really love this episode, especially if you are a driven advisor looking to get better in all ways. Niko has some nuggets. He has proven it, but this is just another one of those episodes where I wanted to give you an opportunity to meet somebody I think is doing good things in the industry, and I wanted you to get a chance to see what makes them tick. So here we go. Episode 303, Niko Caparisos. All right, Niko Caparisos, welcome aboard to the Bullpen Sessions, my friend.
Hey, good morning. Nice to be here.
Yeah, no, you've been on the Broker's Voice before. I think it was a couple years ago, but I wanted to bring you on the Bullpen Sessions just because it's been a couple years, and you're doing some fantastic work with your community-owned health plans. So we're going to talk about the COHP. I think a lot of people are going to want to hear about that. But we're also going to use this as a chance to let people get to know you because you also have some very strong beliefs about fitness, health, all that stuff. So I can't wait to dive in because I want people to learn what makes Niko tick. You cool with that?
Oh, all right. I love it, my friend.
I know you have a lot of beliefs. You put them out on LinkedIn, which I love. So I do got to ask, though, we're recording on August 16th. We're a couple weeks away from the start of the college football season. You told me offline, Prosperity Benefits, your agency, is completely 100% UGA alumni owned, which is awesome.
Yes.
What's your outlook for the Bulldogs this year, man? Is it another national title?
Well, owned and staffed. So my ownership, but then my new employee, Georgia, is obviously a UGA grad too. So totally cool. Yes, always hoping for the best. You know, I'm always pleasantly delighted when we get that far. But I also, as mentioned too, I'll out myself here. I'm not the hugest, organized sports fan and follower. I know just enough to get by, but I definitely love my home team. And whenever I can get to Athens, it's always a good time. It's just reliving.
Been there once. It was a good time. Yeah, went to Georgia Ole Miss game years ago.
Very cool.
If I remember, I think Ole Miss won. It was disappointing because the crowd was out of it. Anyways, I want everybody to hear you have an employee named Georgia in the state of Georgia. Let's not forget that.
Right.
So let's talk, man. It's been a couple years. You and I had done some work together in the past. Community-owned health plans. You know, as the founder of Prosperity Benefits, so your agency's down in Savannah, Georgia. What led you on this path to really wanting to create almost, again, an entire health plan unto itself, community-owned health plans? What was the mission behind that?
Honestly, it was in having had the chops as a retail broker and trying a lot of things at the time when I established COHP, I had been at work for 12 years, right? So trying RBP, trying different vendors, different, strategies, different, sales tactics with clients. And the more I learned about self-funding, the more I just found it fascinating, right? And then as I continued to have conversations with the industry, I saw that there was a need, for brokers that didn't know how to necessarily prop up health plans from the ground up, right? And work with said vendors to really coalesce things together in a way that made meaningful sense. And honestly, it wasn't just the fact that I wanted to help brokers, it's that I want to help more people, right? So I said, look, if I can do these things on the retail side and I can get fancy with plan design and vendor sets, and I know kind of what's working and what's not, just trial and error, because I'm not an uber scientific guy. I'm more like, let's kick these tires and then let's pay very close attention and who is fulfilling promises as well. And what kind of people are you working with? So all these things kind of culminated together. But honestly, it was reading one of Dave Chase's books, and it was Re-Localizing Health. And I had already been in the health representative ecosystem for a while. And I said, look, I need to have a company that really touts local, that helps the community, Part of it is just simply saving on premiums and relinquishing control, right? That is otherwise just put out to the masses and national factions and backdoor deals and all the things we know about. But that was it. I just want to help more people. And so I created an entire company dedicated to just that. And I'm a broker's broker, right? I'm there as a resource and still a retail broker where I live in Savannah, Georgia. But everywhere else in the country, I have people that are, my buddies or my new acquaintances or folks that send me really hard cases or things like they want a high performance network, but they don't know how to begin. And so that's kind of where I fit within that rubric of being able to help brokers and their clients. Is a brand new solution that I, propped up.
Yeah. One thing I admire about it is you said, I really just wanted to help more people.
Right.
And I think it's easy for a lot of people to say that, you're not the first advisor in the industry to come up with your own solution. You then have turned around and worked with other advisors on. However, I think a lot of those solutions, unfortunately, hit a point where it started with the right mission, and then the desire for revenue growth became the number one priority, and they kind of lost their way as to why they're doing what they're doing in the first place. And I think your mission has always been true, that I just want to help more people with this. And I really admire that. What are, you talked about Dave Chase's book and the whole Re-Localizing Healthcare. What are some of the core tenets of a community-owned health plan?
So the biggest, most obvious one would be to tap into a local high-performance network so that you actually have the ability more easily to steer within the plan design and to, have people select high-performance vendors that reduces their out-of-pocket costs. So that nothing is new with respect to that. What is new is that, part of this community-owned aspect is to, again, adopt into a community-based health plan direct contract. So there's a lot of noise, not really noise, but talk in the industry, right? Rental network versus having no network versus direct pay versus a combination thereof, right? And you have to meet people where they are. But really, one of the gold standards that appears to be, coming through the fray as something that is, again, something everyone wants to see with their clients is local-based contract, right? RBP level pricing with a direct contract, and with all the proper, bolt-on solutions to help manage the claims thereafter. So that's one of the things I can tap into on a national basis, one of about 75 high-performance networks. So in a broker's, mind, where they may know that there's a direct contract with UF, right, in Florida, or Centura Health in Colorado, right, or whatever the hospital system may be, Baylor in Texas, right? So they can actually work with me to tap into that, high performance network, because I've already built the architecture and all those connections, and it's turnkey, right? Instead of having to try to navigate that autonomously. So that's one of the features. Obviously, on the pharmacy side, that's a really low hanging fruit piece as well that a lot of folks talk about. One thing that my health plan enables, irrespective of network choice, is that independently owned pharmacies, they award, if a member chooses to go there, with a lower copay out of pocket, right? With HSAs, it gets a little more dicey because you have to come out of pocket a little bit first, obviously. So a 50% reduction in the copay is not really going to be felt. But that said, if you have a copay style plan, it's $50 at a national chain, and you go to, Susie's Pharmacy, right, that you've known forever, been there 30 years, like local business owner, doing care people, your copay will be $25, right? Independently speaking. So there's a few different ways that the community is helped, but it's also just very collaborative, right? Like some of the guerrilla style marketing approaches that brokers that like to adopt this line and walk this line actually will do is to see if there's a local pharmacy that's interested in introductions, right? Because knowing not only that they will be helping their local community, but the model also allows for them to get paid more, right? As their dispensing fee. So instead of it being a quarter or a dollar, it's $8, right? And that's a modifiable amount. But either way you look at it, it's multiples more than the national PBMs. So the pharmacy's getting paid more, the member's paying less, right? Due to the formulary and plan design and all the features that we baked in by way of sourcing and 340B optimization and the rest. It all comes together super nicely, right? Like anything that I could think of to make it community oriented is something that continues to be, in process, right? But there's a few things solidly that are already there. Save money, buy local, right? Go local for pharmacy benefits, keep people with local doctors, right? I mean, these are all just tenets of the program, and they come in through the product, right?
Well, and I think what's important, again, referencing Dave Chase, Re-Localizing Healthcare, is I think it's easy in the benefits industry right? To say, to have this us against them mentality when it comes to the healthcare system. And what you're doing is, instead of trying to create the us versus them, it's the collaboration. You're actually trying to promote the local hospital. You're trying to promote the local pharmacy and reward employees when they keep things local. And I think that's what I want advisors to hear. It's about collaborating with the system, not fighting with them.
Yeah, you're totally right. And that's what also makes it more fun, right? Because we go to these conferences and we see our friends. And like, I was talking to a good friend, I'm on his advisory board, right, just yesterday. And I was like, you guys are just my people. Like, when I go to these conferences, it's just so fun. Like, I just feel like we all have this deep current of connections. And I felt that years ago in 2020. I was like, I want to be able to work with these people, right? And to be part of the ecosystem and the thread and the fabric of connecting people and vendors and being a part of the solution. And you're right. Like, it's more fun. And, you can win without really many people losing, right? And the losers, if you will, they're not really directly involved in the local community anyway, right? So without pointing fingers, it is what it is. Like, we're just
and the local providers are winning because you're encouraging foot traffic and incentivizing local foot traffic via how you design the plan. I mean, that's what's really effective. And I want people to hear, I think you said 75 access to 75 high performance networks around the country.
Networks. Yeah.
This isn't just something you're doing in the Southeast. This is available to advisors all over the country.
It's national. And I'm glad you mentioned that because, there are pockets of cities where there's already just one hospital anyway, right? Mm-hmm. So that's a no-brainer. And then you can obviously put a wrap network in for out-of-area access, which is, again, just baked into the plan design itself. But for those that don't have a narrow network, right, or there's too many hospitals, the employer doesn't like that idea or that strategy, even though we know it's a tight wrench and it does tend to work, right, by way of controlling costs and steerage and all the other things, they can still access the Cigna PPO, right, or a variety of other different network options that are more, widely known, commonly accepted, walking that line, if you will. So it's flexible.
What was your experience like, Niko, when you first created the model? And obviously you were eating your own cooking by doing it in Georgia. What was your experience trying to get the local communities to buy into that when you first started pushing this model out to the public?
Yeah, it's interesting. In my market, it's actually kind of funny because I do wear both hats, right? Because I am known as like the retail broker. I mean, I have retail groups. I've been serving the community in that way for 12 years prior to starting to collaborate with people. It was funny, it's easier for me to work with out-of-area brokers, right? So I'll say that, dynamically speaking, it's way easier for me to work with anybody outside of Savannah because they don't see me as a competitor, right? So that's kind of a natural fit. When it comes to, the adoption of these high-performance plans within the local community, it's slow coming. And it seems like it wouldn't be the case, but when you have to actively describe that a high performance network would pay someone faster or more directly, or, less turnaround time, less claims edits, less of a discount, right? Like, what's the actual ultimate result? You just have to educate so many people on what's actually already going on so that they know that there's a problem to solve for. And that's the big challenge, right? So I've struggled a little bit with that. But also, if you just find people that want to listen and then they know where your heart is and where you're coming from. And, I worked with a local pharmacy to get introduced to a local employer. And I was like, look, I have this plan. It rewards local. Do you know of any companies that may want to benefit from that or take advantage of it? And if that works for me in my little sleepy town of Savannah, Georgia, any broker can just go onto a map that I can provide them and say, hey, why don't you reach out to this pharmacy and see if they know any business owners? Because we've got a plan down to 10 lives that could pay them more. It's more equitably built. It's transparent, all the things. And no one's coming through with that message, right? I like to think that I thought of that level of marketing approach, but that's just one creative thing that people can leverage and use, right? They can talk to DPC providers and say, we've got a plan to offer that perfectly pairs with TPC via plan design, right? So I've had fun with it. And I think a lot of brokers can, and it has been fruitful, right? Like who wants to say no to a locally owned and controlled plan from a local consultant that brought it to their door? I mean, it just checks so many boxes. But
it also it proves how much our industry has evolved.
Yep.
The days of just being a broker who's slinging spreadsheets and quotes are over, right? You have to bring something more valuable to the market. And I think what's the evolution you have seen is consultants. I'll call them consultants because they're not just brokers, consultants who are starting to integrate into how do we bring our health plans I've been selling for years together with the healthcare system to create a better experience for the employee. Because at the end of the day, the end user is the employee.
Right.
And I think some brokers, some advisors have to be careful because you have people who are starting to say they may know more than the doctors. And I don't think that's a good idea.
Yeah.
But at the same time, what you're doing is saying, hey, guys, if we're going to fix this, it's not fighting, it's collaborating. And you're not becoming just an asset to your own clients. You're becoming an asset to the entire ecosystem and to the community locally because you're helping keep foot traffic in the city, whether it's Savannah or anywhere else, which is benefiting the local hospital, which has been, I love the idea you're promoting the local pharmacies, the independent pharmacies that still exist. Who loses in that equation? That's my question.
Yeah, I mean, it's the entities that aren't willing to go down the road of customization or carving things up or disclosing things preemptively. And we live in this ecosystem. It's just really kind of obvious to see. But it is so much more rewarding to get that consulting hat on. And when I work with brokers that are like, look, the rates are this, I say, well, how can the carrier be profitable at that level, but the other plan can? It's like because there's more revenue involved or because they're not paying out as much in claims due to the edits and the clawbacks and the rest. And so it all ends up making sense, but it is, again, just so much more satisfying to be able to be a consultant and to say, here's these various different programs. Here's why they're priced differently. This one's built for stability and this one's built for a 12-month win, right? Anyone can sell you this one. I'm probably the only person that's going to talk to you about a more refined, in-depth strategy to stabilize long-term and to incorporate care within the model, which is also tremendous, right? Which a lot of these solutions don't really address. It's not about, as you said, the member coming first. It's about what's the spreadsheet look like? What are the premiums? What are the deductible benefit levels? And the members are kind of stuck twisting. It's like, well, what about my care? So that's been addressed with the plan design too. So not only local, it's actually, metabolic health improving initiatives. And I'm not a clinician. I'll be the first to say it, right? But reading a lot of books that were authored by very, very intelligent, storied career physicians that choose to now tell the truth on what they know, that's been fascinating. And it's taken me down a whole other terror of like, if we can get people healthier via the plan design and just to enable the knowledge, right? Aren't we doing more than a lot of plans out there, right? Like proactive outreach. Let's talk about nutrition. Let's get you healthy, right? That's also
it goes back to your mission to help more people.
Right. That's it. And
one thing I'd love to get you, I got two questions on this because I really love to hear your feedback on this. So you started this journey roughly in 2020. Right.
Yep. Tail end.
And here we are 4 years later and you're still at it, which tells me this is a mission for you. You didn't do this just for another revenue opportunity, because if you had done it for just another revenue opportunity, you probably wouldn't be doing it anymore. And I can tell you're passionate about this. How have you seen the COHP model evolve over the last 4 years?
So down several different roads I had walked, right? Trying to find the right partners, right? Trying to build something, trying to prop something up, trying to generate enough interest, right? Without having, thousands of lives or hundreds of broker relationships, to offer to a vendor to try to do something bespoke from the ground up, who also in turn believes in doing the right thing, right? Was a little bit of a challenge. I would approach this vendor set and this basically stack and see what I can customize. Like, where did I sit on the priority list? Like, maybe it was high, maybe it was low. Maybe there was a competency that wasn't there on my side or the vendors, right? Or maybe they weren't ready for it yet. So it's been a lot of trial and error, but I feel like that's just how you get things done in this industry, especially when you're doing things like build a network as you go, direct contracts via payment, methods that are built into the plan design. So it's not something as easy as just saying, hey, here are the plans. It's going to be Cigna. It's going to be underwritten by whomever. And here's the set of vendors, right? So it's been a lot of, honestly, just trying this, trying that, placing groups in, seeing what the challenges have been, seeing what vendors have performed well. And so to this point now, I have involved in requisitioned, I guess, on a retainer, Health Rosetta's advice, right? So I'm a Health Rosetta Excel-based advisor, and several other plan builders are. But it's been interesting to work with them to try to cement what the path actually looks like and to actually create the product itself, right? With a little more direction than just saying, well, hey, let's do this. And then you can unbundle a plan, but it's not a product. It's not a portfolio. It's not something necessarily bespoke that you can go resell. So while it sounds simple in nature, I've learned over the past 4 years, like you just have to keep, bobbing and weaving and figuring things out and changing things up. And now I'm to the point, selfishly, I can say like the price point's been hammered through, and having so many different passes at underwriting with different entities. The plan designs are locked and loaded. The vendor set is effective, so it's been an interesting first few years, but again, it has been kind of more of a project than my primary day to day, which is still retail broker. So it's good because I know that lane really well. It's less good that I'm not as available as I want to be all the time, but I still try to get it all done,
We're going to talk about that in a second, because I think you've done something really well on the retail side that I want other people to hear. Last question, though, with the COHP. Mm-hmm. That's what you just said. I want everybody to hear. You've done the legwork now. You've vetted the partners. You've gotten kicked in the face as you're trying to grow this. You now have gotten to a point where you feel you've got a good partner stack and a model in place you can bring to other markets. If I'm an advisor listening to this and I'm like, okay, I'm in Illinois or I'm in Oklahoma, wherever, and this is an idea I would love to bring to my market, what advice would you give an advisor to when it comes to starting this kind of conversation locally?
Yeah, I mean, I would say the newness of the dialogue is probably enough to get some doors open, right? Just because it's so atypical. But I think that if they just have the messaging of like, this is a health plan built for our community and it's a new model, would you like to hear about it? I just feel as though the answer would probably more likely be yes. I mean, maybe I'm optimistic in my thinking. I know people get busy and it is cold calls that happen, or it's a cold email, or it's whatever it is, or walking through the door, which incidentally is very effective. I found earlier in my career, just grabbing a business card and being a friendly human, be like, can I email this person? Is the right person, right? Yeah, it's not hard to do either. It's actually kind of fun. But I would just say to have those, those dialogues and lean into the strategies that work. And if someone wants to bring something new to their community, that has to be part of the messaging, right? Because people are tired of the same old, and they all think that brokers are a commoditized industry where it's all access to the same things. So if I was a broker listening, then I would realize that maybe I could introduce some efficiencies, right? Maybe it's not different or varied knowledge to what they already have, but if you want to rework and recreate something from the ground up, that's exactly what I did. It's a lot, right? A lot of folks look to me with the same level of knowledge for all the different aspects of plan building and the rest. And we collaborate as peers, but they just look to me as an efficiency. They're like, Niko knows the speak, he knows the language, the underwriting, he'll be able to flag something, he'll be able to triage an issue, work through something with me, talk with a client, right? With me in collaboration with me to explain it, right? If that is useful and called upon to do. So, that's how a lot of folks that are already to the point where they can unbundle, they say, well, what do you have? Because I've been doing this, or I've got some challenges over here, and they just see me as a partner, and I'm happy to do it, and I might have a high performance network where they live. It just really depends on where geographically they are,
Well, and you said it, I think you go, if you're an advisor today and you want to separate yourself and you go to a healthcare partner, like a hospital, local pharmacy, and you say, I got an idea to bring you more revenue.
Yeah. I mean,
who's not going to want to listen to that?
They should. I mean, they probably might think that they're being tricked or duped, or it's not the actual message at the end, right? It's a bait and switch. But I don't know. Once you get somebody live, like that's the biggest challenge, right? Yeah. Like I've found for years, and Andy, you're probably the same, where it's like once you get an honest chance to have a dialogue with someone, and you get past that first 5-10 seconds on the phone or whatever, and you actually have their attention, they can hear whether or not you're genuine or not. They can be like, what is this? It's like, well, no, this actually it pays you more. And some companies will be a risk candidate for these kinds of programs. Others won't, but I just want to at least show them that as an option, right? And if that wins, you win, right? Yeah. And if it doesn't, then you don't lose. So what is the downside?
I can remember when I was advising in Colorado, and Jim Milway, who a lot of people know, came out with the zero card.
True.
And he was looking to get into the Colorado market. And I remember I had made some introductions to him to like some local surgery centers and things like that. And I just remember that experience of, I hate to say how easy it was to get in front of a hospital executive or a surgery center executive to say, hey, I want to introduce you to something that I think is going to drive more foot traffic to you.
It's great. And how much more fun was it too than
it was a much more enjoyable. Now, did I make all of those surgery centers and healthcare partners clients? No, but it was that enjoyment of creating something for the market that was bigger than just freaking selling a health insurance policy.
Right. Yeah. You differentiated with even just the approach. They were like, no one's talking. It's like this Andy guy might not be like every other broker we've talked to. And clearly you weren't at all. You were like, I'm facilitating a connection, and this is a value. My messaging is on point. It's different, but it's also truthful. And if more folks did that, then we'd get a lot further than the spreadsheet.
Well, right? And that's the good news, though. We have a lot of good folks in the industry around the country who are trying to do, with what you're doing with the community-owned health plans. I'm sure there's probably a lot of people listening right now, Niko, that didn't know about the plans that you've created until today, and I'm sure you're going to get some people who reach out. Let's transition here for a little bit. You brought up earlier how as the COHP model has grown, your attention has shifted a little bit, and which has probably taken a little of your attention away from the retail agency. You still run Prosperity Benefits in Savannah. One thing I've always admired about you, man, is you have built your agency around your lifestyle.
Yep.
Talk to me about that. I think as I look at you, you're not a guy that I see, and I hope you don't take this the wrong way. You're not chasing a $5 million, $10 million book. You're like, no, man, I built an agency that lets me do what I want. Talk about what was behind your design of Prosperity.
Oh, interesting. I love this question, first of all, and I appreciate it. So I remember reading in one of the benefits publications, years ago, my book was smaller than it is today, right? But I remember reading like the producer rule, and it was written for some, national or regional brokerage house. Every producer needs to put in, $750,000 in terms of their book size for the model to work, for them to earn enough to support account management, overhead operations, all the things. And I remember being a little bit disheartened. I was like, well, that would be a lot more activity and a lot more work. And I'm like, how will I even get there without trying to hire someone? Like, I need bigger clients. I need that. Several people tried to advise me into doing just that, right? It's like, you need to hire, you need to invest, you need a brick and mortar. And the longer I went on just doing what I wanted to and being creative and not overloading myself with too many clients to be able to take care of a certain way, right? I just said, I just continue this model. And every couple of years, I'll look at it, right? Someone will approach me for purchase, or they'll say, do a merger or consider this model or that, or we'll create efficiencies for you. And honestly, I mean, the way I've set my business up, it just caters to my lifestyle. Like, you can set appointments when you want, right? I try to keep Fridays fairly open for obvious reasons, personal errands, taking the car in, getting a haircut. I mean, like, these things that I just have to get done, right? But I've done that with almost every day, right? Like, I don't overschedule myself. It's harder to get on my calendar than it used to be years past, but it's very intentional so I avoid burnout. And if I'm doing that, then I can put the best work and best product together on either side of the house. And then I can be the best partner if I'm not stressed out, and I can think clearly about what I should do, where I should focus my efforts and time. But it's been interesting, man. It's mostly knowledge from other people. It's like the books, like I can see behind you, it's positioned the bookshelf. Like I've shown so many callers mine where it's just stacked full of like productivity, industry, self-improvement. I just nerd out on all that kind of stuff. And I don't know, I've just built the model, like keeping that in mind. I'm like, how stressed am I? Like, what do my days look like? What do I want them to look like? What do I need to do in order for them to look different? And it's just thinking critically, but it's been a good balance, Yeah,
you've done a great job. And I think a lot of people get confused. If you're not on this mission to build the biggest agency you possibly can, well, then you're not driven. You said the word, it's intentional.
Yeah.
You got it. What's your intention? And I think that's important for people to understand is if you know your intentions of what you're building and you're meeting that intention, that's all that matters.
Yeah, you're right. And it's like, what do your days look like? And it sounds so basic, but there's a reason why we all get distracted and we want to like reach for our phones whenever we have like a spare dull moment. And it's wild, but it's like, because thinking requires so much more effort. But when you think critically about like, what do I want my life to look like? And I'm going off script here, but it's like, no one is like, I wish I worked more. in the end, right? And it's like, I'm trying to keep that in mind.
Yeah.
Like, yeah, the kids are young. I've got 3 daughters. People don't.
I say you're a girl dad. All the shout outs to the girl dads listening in here.
Yeah. And there's quite a few of them, and a lot of us know each other too, which is great. But yeah, it's like, how do I want my days to look? Because like this, I'm in the throes. Like I'm in busy season. Like I'm in, my kids are little. They need a lot of my time and attention, and carting folks around, and it's all wonderful. But I try to keep in mind, like, hey, I need to balance this now because this is what it's about. These are my days. This is what they look like. Like, let's enjoy them.
I didn't intend to ask you this, but you were talking about books. I know you're a big follower of stoicism.
Yeah.
And I assume you've probably read some of Ryan Holiday's books.
Let's see. Call me out.
There we go. I was going to ask you, reading those books and just the whole philosophy of stoicism, how has that impacted your business and your life? I'm curious.
Gosh, life more than business. But again, I think it just provides a good framework, to think through problems and challenges. And it's a little bit liberating, honestly. I mean, I was telling someone just yesterday in conversation, it was a client, and I was like, I will do things that seem counterintuitive. Like I'll be having a really great, wonderful day with my family. It's sunny and everybody's happy and we're together and it's just like beautiful, relaxing moment. And then I have the thought of like, enjoy it because it's not always going to be like this. Right. And you'd think that would be a downer, but it's not, right? It's like, if a vacation's going to end, you maximize it. If there's no end point to anything you're doing, you're like, well, I guess I'll just continue on. Like, I don't really know the structure of this, but same thing with life, and I read a Ryan Holiday publication every morning almost, right? Like it's the Daily Stoic, it's the Daily Dad. I've got meditations, excerpts anyway from that book over there that I just showed you. And gosh, I try to apply it to business too, where it's like, is this a huge earth-shattering deal or not? Like, am I giving this my best effort or not? Is this even my responsibility to solve for? Like, let's look objectively at this. And you just kind of get a nice operating, view of how things should be. So that's what it's been like for me. It's I'm just shy of getting that big calendar where it's like it shows all the weeks of your life, right? And you like literally every week it's like a little box that you black out, and it's like this one's done, right? And me being almost 40, like, I would be to the midpoint, and like you're in the same boat, right? It's like, what are we going to do with the rest of the half, right? Or whatever we're blessed to get. But it's been a nice perspective, and a nice way to be able to let go just with common like fundamental truths and be like, I don't need to worry about this. Like it's in the grand scheme, nothing big.
Yeah. It's, the one truth or the one fact about time is undefeated.
Yeah. Yeah.
It doesn't slow down for you.
I have not heard that.
And so I heard that from Jesse Itzler.
Oh, nice.
Because you're talking about getting to the back half of your life, right? Time's undefeated. You choose to whether to be present or not, but time's undefeated. It's going to keep ticking.
Yep. Yeah. And it's so much of all the efforts that I do and I'll put out, messaging wise, it's like, I want people to be, if I have a say in it, their happiest, healthiest. Like I genuinely want, and that's where I'm coming from with anything I say and what I do. I'm like, why would I put a metabolic health improvement vendor in the plan? Why would I do that? It's because I want people to get that guy.
Yeah, you're not looking for a couple extra PEPM revenue dollars. No, you're actually
and
trying to make
it's net. It makes it harder for me to sell the product. If some people are like, well, we don't like member outreach, we don't want to be involved with health at all. I'm just like, well, then this may not be for you. But like, I'm doing this because I think it's the right thing to do. And people need guidance. They need help. And it does make it harder for me. But when is doing the right thing not a little bit more effortful, right? Like,
talk to me a little bit about health and fitness. What does your routine look like? I know you're a big proponent of it.
Yeah. So it's always a moving target, right? And that's the thing. I mean, being active lately, I think the nutrition bit, I'll tell you honestly, I was on a kick for a few years where I was like carnivore, right? And I was like, I believe that. I've read some things. I've listened to some people I think are credible, right? And I did that for a while. And then I started to dive into more of nutrition, right? And so at this point, I realized that, you can't outrun a bad diet. So how someone looks isn't necessarily how they're operating on the inside. So once I got more serious about nutrition and I ended up overeating, overnourishing myself, even though I was like, I'm having a big ribeye and like some eggs and it's like 2,500 calories. I wasn't optimizing how that ended up being absorbed or used, right? And how I felt. But that said, I've been on a huge nutrition kick, right? So that's been fun and interesting. And it actually necessitates me to move less. So I've gotten more scientific about like how much I can put in effort wise in my exercise and workouts, which continue to just be varied and fun, right? Sometimes I'm in a running kick, right? I was doing jujitsu for about 5 years, recently pared back on that, right? I've started to throw my leg over the saddle and get on the bike again, right? Like this is fun. Doing body weight only pretty much all year and learning new different exercises. That's also been, right, like something that my body has really adhered to very well and modified. And it's like, it's fun just to kind of keep things loose and change things up just so you're not bored, right?
Yeah.
And to make progress.
I like that. You're not holding yourself to some standard to say, well, this is the diet I use, or this is my workout routine I always do. It's keeping it open to whatever feels good for you in the moment. And I think that's why I there is no perfect diet. There's no perfect exercise routine. It's what works for you. Just eat well, eat healthy, and keep moving.
Yeah. And that's the thing. And they build on each other, right?
Yeah.
So it's like, because my nutrition's been more on point, like I've noticed physically energy levels different, inflammation levels down, right? Like I can do more work. I can see when I can't afford to put in a big day because my recovery is low because I monitor it with the Whoop strap, right? For example. So anything you can measure gets managed better. And I want to make more nerds, right? When it comes to like tracking health and fitness. And it's great because like if we all were like, hey, what is my stress like? What's my sleep like? And we're all on top of it. I don't know. I just feel like everybody would be better for it, right?
And to steal a phrase from the famous philosopher Deion Sanders, when you look good, you play good. When you play good, you get paid good.
Look at that. Well, I was tying it all together. It's like funny to hear.
Former Atlanta Falcon, right? Bringing it all home. Yeah. Last question for you, man, before we wrap up. This has been a great conversation. You are somebody I admire, and I've fortunately had a chance to work with. One thing I know about you is you're driven. And I tell people in our industry, we can coach a lot of things. We can help you with technique, tactics, strategy, but it's hard to just put drive in somebody. What motivates you? What drives you to get up every day and do what you do?
Oh, gosh. I feel like I've always just gone down tears where I've just become interested in things and like taken it to the nth degree, right?
Would you describe yourself as a very curious person?
I would. I mean, I would say creative. I would say like the more I've learned via stoicism and other things I've read, it's like the more responsibility you can take on, the happier you ultimately are. And the example is easily put with like, what would you do if you didn't have to work, right? Or if money was no object. And most people would start like saying, hey, I would just go to a sunny beach and like just drink all day, right? Like that would be a popular notion. Like that's what like the retirement, like that's the pictures on a hammock, like with a pina colada, whatever. And then you run that through and you game it. And you're like, if I did that every day, well, I wouldn't be like taking care of myself, right? And then I wouldn't be happy after a while because I would just do the same thing every day. And like, I might not be with all my friends because they can't afford to do that, right? Even if I had enough money to bring them, like they wouldn't want to just like drink in the sand all day, right? And so the thing that I kind of center around with almost everything I do is like, how am I spending my time? Am I a productive member of society? Like, am I feeling fulfilled? Am I tracking towards something that is positive and by way of an objective or something I want to reach? But it's that one word. It's like responsibility. And it sounds so sobering and like horrible, but honestly, it makes people happy. It's like, we're here to work, we're here to do good things and like be a good person if you can be. And a lot of that's borrowed from stoicism, but a lot of that thought of like Tony Robbins and like other thought leaders. And now with science, like Andrew Huberman and Rich Roll and Dr. Attia and even Joe Rogan. I mean, like all these folks putting out this information, Jocko, I mean, these podcasters, they're just like sharing stuff. Tom Bilyeu. I mean, it's just been so fun to hear these like age old truths just coming through with different words from different people. Yeah. And learning about that stuff has been, it just helped to keep me on track. Right. Yeah. And I'm sure 10 years from now, we'll still be friends. We'll be talking again and be like, hey, you know what? I really started doing this. And like, that's also really helped me,
Well, and in 10 years, you're going to be trying to be a better version of you than you were today.
Matthew McConaughey, right? Green light.
Chasing your future self, right? That's why McConaughey says I'll never be at my best because I'm always going to be chasing me 10 years from now.
And isn't that the best?
Yeah,
I mean, it's like, do your best always with what you have. And like,
and we listen to a lot of the same podcasts. I knew I liked something about you.
I know. I've likewise. Do you do it on 2 times speed? You're like, I know.
I'm not that. I go 1 times. I usually listen to them while I'm working out, and I don't need to go on. I don't need to try to get through some in double time. I'm a 1X guy.
Yeah, 1X. All right. But I speed it up because I'm doing cardio. But weights. I'll do the music, regular speed, cardio, fast.
Well, Spencer Smith, who a lot of people know, had me get on this kick. He's a big heavy metal guy.
Yeah, I know that about him.
He had me try heavy metal while I was lifting, and I did it for a while. Spencer, if you're listening, I got to share this with you. But I found myself by the end of the workout, I was like angry. I'm like, okay, I gotta stop this.
Did it work you up? I mean, I guess that's kind of the point, but whatever gets you going,
Exactly. Okay, last question. If somebody was listening, man, and they're like, okay, this whole community-owned health plan thing is something I really would love to consider, or just want to connect with Niko in general, to bounce something off. And what's the best way to get a hold of you?
Honestly, I mean, connecting on LinkedIn, but I'd love to just do that anyway. But sending me an email is probably the most direct way, because boxes can get cluttered right on the LinkedIn side. But Niko at COHP, as in community and health plans.info. So Niko at COHP.info. And yeah, just to start a dialogue. Like, I've got a formalized pitch deck and marketing agreement and this and that. But at the end of the day, I'm here to work on cases and see if I can help people. So that's generally the best way people can learn, is take a flyer, send an RFP on my way and see what, the stack can do with it. And that's how I can put my best foot forward for them, and how they can actually see what I'm all about and what the product actually looks like. Right. So
perfect.
Best advice.
Awesome, man. Well, it's been great. This was an awesome conversation. For everybody else tuning in, I'm hoping you took a lot of notes on this one, especially if you're a benefit advisor and you want to know more about the COHP model. Make sure to reach out, connect with Niko on LinkedIn, but reach out to him via email, Niko at cohp.info. So thank you, Niko. It's been a great conversation.
Thanks, buddy.
Be good, everybody. That's all we got for today's episode of the Bullpen Sessions podcast. One thing that would really help us both and other new potential listeners is for you to rate this show and leave a comment in iTunes, Stitcher, or wherever you tune in to listen to the show. Also, make sure to link up with us at CompleteGameConsulting.com on social media. And please share this podcast with anyone who you think might enjoy it. Until next time, remember, clarity creates confidence. Confidence creates consistency. Consistency makes you unstoppable.